welcome you all for the yoga session. In this session, we are going to do some basic postures for core muscles, and then we are going to practice one of the fundamental standing postures, Uttita Trikonasana. Lie on your back, fold both the legs, heel closer to the hips, foot 6 inches apart, foot parallel to one another. Feel your breathing. As we inhale, the abdominal cavity should expand. As we exhale, it should contract. Feel also the posterior region, the lower back, that also responds to the breathing. Watch your breathing. Chest should be reasonably stable, neutral. Watch the movement of the diaphragm. As we inhale, allow the abdominal cavity to expand throughout, all around, circumferential expansion of the abdominal and the pelvic cavity. As we exhale, it should contract. Towards the end of exhalation, try to contract the abdominal muscles little more than normal. This is a very fundamental breathing which has to be implemented throughout in all the postures. This breathing not only helps the abdominal muscles but also helps the mind to calm. Stretch both arms up. Breathe consciously. Neck at the center, chin towards the chest. Raise your right leg up. Stretch the heel. Pull the kneecap. Toes towards the knee. Pull the kneecap. Tighten the quadriceps, the front of the thigh. Feel the stretch at the back of the thigh. Watch your hip. Watch the gluteal muscles or the muscles of the hip. Watch your back muscles. Press the left foot. For that you got to activate the calf muscle. Also contract the hamstring muscles against the calf muscle and feel the knee capsule. That is the outer covering of the knee on your left leg. Fold right leg down. Left leg up. Pull the kneecap. Stretch the heel. Consciously watch the muscles of the leg, especially the calf muscle, hamstring, then the muscles of the hip and also the lower back. Do not miss out on your breathing. Breathe at ease. Down. Right leg up. When raising the legs, also ensure that the base of the spine does not take off the floor. Pull the kneecap. Stretch the heel. The muscles of the leg, especially the hamstring, they help the back a great deal. Right leg down, chain, left leg. Pull the kneecap, stretch the heel. The hamstring muscles are connected to the hip bone, and on the hip bone sits the spinal column. So they are all involved in the kinetic or kinematic chain. The health of the hamstring is very crucial. Relax the left leg, right leg up, fold, hold the right knee from both hands and pull the knee closer to the chest. And keep the foot, knee and the hip in the same plane. That is, do not move the knee out of the plane. And on both the legs, squeeze the hamstring muscles against the calf muscle and feel the inner corners of the knee. Also feel the outer covering of the knee capsule. Watch your breathing. Release right leg. Left leg up. Fold, hold the knee, press the knee closer to the chest. This particular posture does help the gluteal minimus and the gluteal medius muscles. These are the two muscles in the region of the hip that greatly helps in all our walking. Pay attention to the breathing. That is the key. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Release left leg. Right leg up. Fold, hold the knee, press the knee closer to the chest. Stretch the heel, right heel, that is toes towards the knee. Do not neglect the left leg. You should press the left foot. For that you have to activate the calf muscle, then contract the back of the left thigh. Watch also the posterior skin, the thick skin resting on the floor. Release right leg. Chain. Left leg up, fold, hold the knee, press the knee closer to the chest. The posterior thick skin on your lower back, the thoracolumbar fascia as it is called, that also responds to breathing. Just watch that. It also experiences a mild stretch as you inhale and a contraction as you exhale. Get connected with the posture, get connected with the breathing, be present. Release left leg. Right leg up, fold the knee from left hand, hold the ankle joint, pull it closer to the root of the left thigh. From right hand, push the knee. On both the legs, contract the hamstring muscles, the back of the thigh against the calf muscle to enhance the feeling of the knee capsule. As you inhale, sensitize the base of the spine. Feel the base of the spine, especially the sacroiliac joint. That is the articulation between the iliac bone and the sacrum of the spine. Release right leg. Chain. Left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh. From left hand, push the knee. It's very important to have complete postural awareness. Do not allow the pelvis to rotate. Release the left leg. One more time. Right leg up. Fold from left hand. Hold the ankle joint. Pull the heel closer to the root of the thigh. From right hand, push the knee. Activate the back of the thigh on both the legs. Breathe consciously. Feel the base of the spine. All these postures are designed to help the core muscles, which would include the region of the abdomen, the lower back, the hip, the pelvis. Because this is the region which takes a lot of loading. And these postures prepare one to safely practice other postures. Release right leg. Chain, left leg. Fold from right hand, hold the ankle joint. Pull the heel closer to the root of the thigh. From left hand, push the knee. This posture also obviously helps the knee joint, the hip socket. Also gets a good soothing movement. The sacroiliac joint experiences a mild but very necessary movement. Good breathing is the foundation for all these postures. Release left leg. Right leg up. Fold from left hand, hold the ankle joint. Pull it from right hand, push the knee across the chest. This is a very good stretch for the gluteal maximus muscle, which is one of the major muscles located in the region of the hip. Again, watch your breathing. As you inhale, the abdominal cavity should expand, as you exhale, it should contract. Release right leg. Left leg up. Fold from right hand, hold the ankle joint. Pull from left hand, push the knee across the chest. Press it closer to the trunk. Now here the abdominal muscles and organs also stand to benefit because of enhanced massaging movement under the pressure of the thigh. Do not neglect the right leg. Press the right foot. Tighten the calf muscles. Tighten the back of the thigh. Release left leg. One more time. Right leg up. Fold from left hand, hold the ankle joint. Pull from right hand, push the knee across the chest. Feel also the lower back. No muscle acts in isolation. They're all connected in a great kinematic linkage. So that is why all these varied movements are essential to keep this whole chain of movements healthy. Release Right leg, chain. Left leg up, fold. From right hand, hold the ankle joint, pull. From left hand, push the knee across the chest. You must do these postures with awareness. Mechanical movements does not yield great results. The movement should be done with awareness. You must be present. You must get completely involved. Release left leg. Watch your breathing. Right leg up, fold, hold the knee, press the knee closer to the chest. Stretch the right heel. Now lift the left foot, keeping the heel on the ground, then slowly sliding the heel, straighten the left leg. Pull the kneecap. Push the knee as close to the ground as possible, while you draw the right knee as close to the chest as possible. So right hip is going towards a strong flexion, while the left hip is going to a neutral position. In effect, this is a very good movement for the back muscles. Slowly fold your left leg, taking the heel closer to the hip. Release right leg. Chain. Left leg up. Fold, hold the knee, press the knee closer to the chest. But completely pull the knee. Keep the left heel active, toes toward the knee. Then slowly slide the right foot. Keep the heel in contact and gently slide, straightening the right leg. Right heel also have to stretch, toes towards the knee. Pull the kneecap. Charge the thigh as close to the ground as possible. Feel the region of the tailbone. Breathe well. All these movements are very useful, especially in the beginning. Slowly fold your right leg, release left leg. Right leg up, fold, hold the knee, press the knee towards the chest. It's also important to repeat these postures. Then slowly slide your left leg forward, straightening the left leg. When you do that, ensure that you maintain the line and length of the left leg. That is, you should not deviate the axis of the left leg. Watch your breathing. Feel the hips, feel the thigh, feel the lower back. Slowly fold left leg, taking the heel closer to the hip, then release right leg. Chain. Left leg up, fold, hold the knee, press the knee closer to the chest, stretch the heel, gently slide the right foot, keep the heel in contact with the ground, raise the foot, then stretch right leg. Pull the kneecap. Feel the pelvic cavity also as we inhale and exhale. So these movements prepare the core muscles for further action so that they become very safe to practice. Slowly flex the right leg, then release left leg. Be attentive. Right leg up, fold, rest the right ankle just below the left knee, rise the left leg from both the hands, clasp the left thigh, pull closer to the chest. Also move the right knee slightly away from the trunk. Feel the region of the hip. You must feel the deeper muscles in the hip. Keep both the heels active. Slowly bring the left foot down. Take the right leg down. Chain. Left leg up, fold. Keep the ankle slightly below the knee. Rise the right leg, clasp the thigh from both hands and pull closer to the trunk. Both the heels active, toes towards the knee, which means the calf muscle gets a good stretch. Do not lose track of the breath. Release right leg, left leg also down. One more time. Right leg up, fold, ankle joint just below the left knee, stretch the heel, rise the left thigh. Now from left hand hold the left thigh, pull from right hand, push the right knee. Now you can feel enhanced stretch deep in your right hip. You are stretching one of the important muscles, the piriformis muscle, the deeper muscle in the hip, which happens to be very close to the sciatic nerve. Release the legs, right leg also down. Chain. Left leg up, fold, ankle just below the knee, rise your right leg with knee flexed. From right hand, pull the right thigh, from left hand, push the left knee. Keep the heels active. So all these postures rejuvenate the muscles in and around the lower back, hip, pelvis. The hip joint also gets a very rejuvenating movement. Knee and ankle also become active. Release the right leg, left leg also down. These set of movements help one to prepare in a safe way for doing other postures. Rise both legs up, hold the knee, press the knee gently towards the chest. Breathe well. Even here, stretch the heel and tighten the hamstrings against the calf muscle. You must make the posture as effective as possible. Also watch your breathing. Watch the posterior region, that is the thick skin resting on the mat, especially the lower back and the lower part of the upper back. That's where the thick skin, the thoracolumbar fascia is spread. Just watch. And tightening the hamstrings helps the knee capsule a great deal. Stretching the heel helps your ankle joint, the arch of the foot, the intricate muscles, ligaments and joints in the foot also. Do not neglect the muscles of the forearm and upper arms. That also you should actively engage. And of course, you've got to breathe consciously. So when you do all this, your mind cannot oscillate. It will be in the posture. That is when the posture becomes a yoga asana. Release the legs. Feel the breathing. Stretch your left leg forward. Roll onto the right side. Press the left palm. Slowly get up. So these are some of the basic postures that greatly helps one to relax the most taxed portion of our system. Sit upright in cross-legged posture. We are going to do a basic standing posture. Rest the knee on the blanket. Take your right leg forward. Flex the right knee. Chest and envelope both hand on the waistline. This is another important posture. Right hip in flexion, left hip in extension. This is also good for the hip flexors. Slowly come up. Right leg back, left leg forward, inhale, exhale. Flex the left knee. Chest and navel up. On the left leg, you have to tighten the hamstrings. Feel the inner corners of the left knee. Breathe well. Slowly come up. Left knee back. Right leg forward, bent at 90 degrees. Then hold the right ankle joint from the right hand, left hand on the waistline. Straighten the left leg. Keep the right knee flexed. Tighten the right hamstrings. Then slowly straighten the right leg. Well, open the left shoulder. Right foot should center the left foot. Right foot turned at 90 degrees. Left foot turned slightly inward. Both legs straight. And look up. Turn the neck and look up. Both legs straight. Even pressure on the inner and outer ankle at the right foot. And you have to press the outer edge of the left foot. For that you have to roll the left thigh out. Flex the right knee. Then descend. Take the right leg back. Chain. Left leg forward. Bent at 90 degrees. Bend sideways, hold the left ankle joint. Right hand on the waistline, right leg straight. Press the outer edge of the right foot. Left leg initially flex a bit. Tighten the hamstrings. Then slowly straighten the left leg. And roll the pelvis jawline. Roll the right shoulder back, chest up, look up. Push the root of the left thigh down. Press the outer edge of the right foot. For that you have to increase the arch of the right foot. Even pressure on the left foot. Flex the left knee, bring the right knee down, left knee back. On your knee, now bend forward, keep the fingertips on the floor, take your right leg forward, right knee slightly bent. Stretch the toes towards the knee, press the heel down and pull towards you, and then gradually straighten the knee. Push the right thigh down. Feel the stretch. Feel the stretch in the back of the thigh. Take the right leg back, left leg forward. Straight the heel, press the heel. Keep the left knee slightly bent to begin with. Tighten the hamstrings, then slowly straighten the leg. You have to extend the knee. And push the root of the left thigh down. Feel the stretch in the hamstring muscles. For any standing posture, hamstring muscles play a vital role. In this posture, the hamstring muscles get a very good stretch. Take left leg back. Kneel down, take your right leg forward, bent at 90 degrees, bend sideways, hold the right ankle joint from right hand, left hand on the waistline, left foot turned inside, left leg straight, then gradually straighten the right leg. Well, open the chest, pull both the kneecaps. Now align the right hip with the knee with the ankle. For that you have to properly position the right foot turned at 90 degrees, even pressure on the inner and the outer ankle. Roll the pelvis, trunk and the legs should be in the same plane. Flex the right knee, come down, Take your right leg back, left leg forward, bent at 90 degrees, left foot evenly placed. From left hand hold the ankle joint, right leg straight, right hand on the waistline. Slowly, gradually straighten the left leg. Roll the pelvis, roll the right shoulder. Well open the chest, turn the neck, look up. Uttita Trikonasana. Left foot in line with the right foot. Press the outer edge of the right foot. For that you have to roll the right thigh outward. In all this, breathe mindfully. As you inhale, abdominal cavity should expand. As you exhale, it should contract. Flex left knee. Come down. Take your left leg at the back. Land your chest. We are going to do a small backward bend because raising the chest is also equally important in Uttita Trikonasana. As you see, we are trying to build up Trikonasana sequence by sequence. Keep both the palm pressed by the side of the forehead, middle finger pointing forward. Stretch the foot back, tighten the calf muscle, press the palm, inhale, exhale, raise the trunk. Well open the chest, lift the neck up from the clavicle, look up, press the palm, well open the chest. Breathe well. Tighten the calf muscle. Do not hold the breath in any of these postures. Keep the breathing near normal. Slowly come down. Keep both the palm below the shoulder joint, middle finger pointing forward, press the palm. Stretch the toes, tighten the calf muscle. Inhale, exhale. Extend the elbows, rise the trunk, well open the shoulders. Lift the neck up, look up. A good hyperextension for the complete spinal column. The pelvis, abdomen, chest, they all get a good stretch. The leg, especially the calf muscle, also becomes active. Toes stretched back. Slowly, slowly come down. Keep both the palm by the side of the chest. Middle finger pointing forward. Inhale, exhale, rise. Well open the chest. The different position of the palms help to impart better stretch in a graded way for the complete spinal column. Well open the shoulders, lift the neck and look up. Here the chest is greatly elevated in the Bhujangasana, the backward bend. The scapulae move closer to the spine, and in fact the scapulae moving closer to the spine and elevating the chest is very, very important aspect in Uttita Trikonasana also. The scapulae or the shoulder blade should move closer to the spine and slightly down. Come down. Press the palms, slowly get up. We are going to again look at Trikonasana. Remember the posture of the chest in Bhujangasana, and in Trikonasana also you should get that feel. Stand upright in Tadasana. Pull the kneecap, join the heel. Both hands on the waistline. Jump 4 to 4.5 feet apart. Both legs straight. Right leg 90 degrees out. Left foot inside. Press the outer edge of the left foot. Stretch your right hand. Be strong on both the legs. Inhale, exhale. Stretch and bend onto the right side. Grip the right ankle joint. Well, open the chest. Move the scapulae or the shoulder blades closer to one another. Slightly pull them down so the chest gets elevated. Roll the left shoulder. Turn the cervical neck. Look up. Trunk and legs to be in the same plane. Do not push the right shoulder out of the plane. Push the right thigh down. Slowly come up. Chain. Right foot in, left foot 90 degrees out. Left foot should be as if it is to the center of the right foot. Do not roll the pelvis to turn. Stretch your left hand. Inhale, exhale, stretch and bend down to the left side. Hold the left ankle joint. Roll the right shoulder. Turn the neck, look up. Breathe well. Trikonasana. Feel the pelvis, feel the abdomen, feel the complete spinal musculature. Feel the legs. And breathe properly. Get connected with the posture. Slowly come up. Foot parallel. Jump Tadasana. Fold the blanket. Slightly increase the height and sit at a height. Hips on the blanket. Foot on the floor. Sit in the cross-legged posture. Inhale, exhale, turn to your right side. Left hand on right knee, right hand fingertips on the floor. Well, open the chest. Stretch the spine up, twist the trunk. As you inhale, abdominal cavity should expand. As you exhale, it should contract. All these postures are introduced to make Trikonasana better, and also to provide the practitioner a good deal of insight into the posture. Upon turning, as you exhale, slowly come up, then change side from right hand, grip the left knee, left hand fingertips on the floor, turn. Keep the shoulders even, keep the spinal column upright, but give a nice twist. So educating the muscles in all these ways. First we started with the hip, then the spine, All this enhances the grace in Trikonasana, in general in all the standing postures. Watch your breathing. Slowly come up, stand in Tadasana. We are going to do Trikonasana again. Remember the movement in the upper back. Both hands on the waistline. Jump 4 to 4.5 feet apart. Pull both the kneecaps. Right foot 90 degrees out, left foot inside. Now ensure that the pelvic bone does not rotate. Stretch your right hand, bend onto the right side, hold the right ankle joint. Then open the left shoulder. Both legs straight. Turn the neck, look up. Do not push the right shoulder out of the plane. Be strong on both the legs. Press the outer edge of the left foot. Feel the pelvis, feel the lower back, upper back, cervical spine. Slowly come up as we inhale, both hands on the waistline, change. Right foot in, left foot 90 degrees out, left foot to center of the right foot. Do not turn the pelvis, keep the pelvis in balance. Left hand forward, inhale, exhale, bend, hold the left ankle joint. Turn the cervical spine also. Keep on pulling the kneecap. Trikonasana helps to strengthen all the inhale, come up, both hands on the waistline, foot parallel. Inhale, exhale, jump, Tadasana. Sit upright on the blanket. Clasp the fingers, inhale, exhale, open the face of the palm up, stretch both hands up, and if possible try to push them slightly back so that you can open the region of the armpit. You can glide your shoulder blades closer to the spine and also move them slightly downwards. Activate the muscles of the upper arms and the forearms. Hyperextend the elbow. Also you can see a good extension of the wrist joint. Breathe well. Feel the shoulder complex, feel the arms. Slowly flex the arms, bring them down. Stand upright in Tadasana. Join the heel, join the big toe, pull both the kneecaps, chest and navel up, stretch both arms down. We are going to do Trikonasana. Jump 4 to 4.5 feet apart. Now stretch both arms sideways. But ensure that the scapulae are closer to one another. Right foot 90 degrees out, left foot inside. Press the outer edge of the left foot. Do not allow the pelvis to turn. Inhale, exhale, stretch and bend onto the right side. From right hand, hold the ankle joint. Left hand up in line with the right hand. Look up at your left palm. Push the root of the right thigh down. Press the outer edge of the left foot. Arms, trunk, legs in the same plane. Uttita Trikonasana. Watch your breathing. Inhale, come up. Stretch the arms parallel to the ground. Chain. Right foot in, left foot 90 degrees out. Do not turn the pelvis. Stretch the arms well. Inhale, exhale. Stretch and bend onto the left side. From left hand, hold the ankle joint. Rise your right hand to align in line with the left hand. Look up. Turn the neck. Look up at your right palm. Press the outer edge of the right foot. Increase the arch of the right foot. Keep the left heel even. Even pressure on the inner and outer ankle. Breathe well. Inhale, come up. Foot parallel. Arms parallel to the ground. Inhale, exhale, jump. Start off. Sit on a folded blanket. Sit upright. Chest and navel up. Eyes gently closed. Watch your breathing. Trikonasana strengthens the muscles of the legs, also helps the stability of the ankle, knee and the hip. It also helps the back muscles. The intestinal muscles and organs also stand to benefit. The complete spinal column, including the cervical spine, thoracic spine, they get a good rejuvenating movement. The arms also get a good movement in Uttita Trikonasana. So doing some of these postures, with the hip, with the trunk, in association with Trikonasana, helps the practitioner to consolidate on the standing posture. Completely relaxed. Breathing and heart rate should get normalized. Namaste.
योगेन चित्तस्य पदेन वाचा मलं शरीरस्य